This week, I want to look at AI in the skincare market, not just whether AI can recommend skincare ingredients or whether it can write a skincare routine, but what this actually means commercially and strategically for aesthetic clinics involved in recommending skincare. Because if a patient or client can now ask ChatGPT, Gemini, a brand website, or an AI skin app to recommend a routine, the question for clinics becomes a little uncomfortable. Why would they still buy skincare from you? So today, potential clients or patients no longer have to wait for a clinic consultation to receive what feels like personalized skincare advice. They can ask an AI tool, upload a selfie, compare products online, or be led by a brand's own diagnostic tool. That does not mean the advice is right, of course, but it may feel convincing. And clinics need to recognize that the retail environment around skincare is changing very rapidly. And of course, for many clinic owners, skincare is not just retail. It supports recurring revenue, helps prepare the skin before treatments, helps recovery afterwards, and keeps the patient in a relationship with the clinic between appointments. So if skincare gets reduced to online price comparison, the clinic is not just losing product margin, it may be losing part of its patient relationship. So as of today, AI can already do some useful things for consumers. It can explain ingredients, compare products, build a skincare routine, simplify choices, and also suggest cheaper alternatives. And some brand tools can also analyze a selfie and recommend products. So the issue is not that AI was always right. The issue that it is always available, and it often sounds more certain than it should. But there are, of course, major limitations. AI may struggle with diagnosis, inflammatory conditions, skin of color, barrier damage, melasma, medical interactions, pregnancy or breastfeeding considerations, post-procedure care, and recognizing when a skin problem should be referred. A generic answer may be useful background reading, but it is not the same as professional assessment. And this means clinics need to reposition the value of their skincare advice. The future role of the clinic is not just we sell skincare, it is we interpret your skin, your goals, your treatment plan and your risks, and then we recommend skincare in context. That is much harder for generic AI advice or direct-to-consumer brand selling to replace. And of course, it's important to recognize that direct-to-consumer selling creates a specific challenge for clinics. If patients or clients can buy from brands, retailers, subscription services, social platforms, or discount sites, then simply stocking a product is not enough. The clinic needs to make the advice around the product more valuable than the product transaction itself. So clinics should build a stronger skincare advice framework, and that means a clear assessment process, written skincare plans, routine review appointments, condition-specific education, post-treatment protocols, and better explanations of why a particular product or routine was chosen. And the aim is to evidence the process, not just the product. A product can be copied, a discount can be matched, a generic routine can be generated in seconds, but context is harder to replace. And the clinic can connect the skincare to the diagnosis, the treatment plan, the patient history, the response over time, and the long-term goal. And that is really where the professional value sits. A good practical exercise for a clinic is to use AI to audit how they currently sell skincare. Are they simply pushing product, or are they adding value through assessment, education, treatment integration, follow-up and trust? The prompt on this slide is designed to expose the gap and suggest practical improvements. And in practice, clinics should make 5 things more visible: how they assess the skin, why they recommend specific skincare routines, how skincare supports treatment outcomes, how they monitor progress and reactions, and when they advise against certain products or refer the patient elsewhere. This links back to the broader expertise theme that I discussed in a previous video entitled "Everyone's an Expert, but Would AI Believe You?" Expertise has to leave evidence. So the conclusion is simple. AI may make generic skincare advice cheaper, faster, and easier to access. So clinics need to make expert skincare advice more valuable, more contextual, and more visibly professional. The clinic's advantage is not just access to products, it is assessment, context, treatment integration, follow-up, and of course, trust.